Welcome to the Clean Plus Chemicals Chemical and Safety Training. In this training session, you will learn the following: understanding hazardous chemicals to improve safety in your work environment, understanding product labels, technical bulletins, safety data sheets and wall charts, and how to practice chemical safety. According to Safe Work Australia, you have specific duties to manage the risks to health and safety associated with using, handling and storing hazardous chemicals at a workplace. Always remember, chemicals can be hazardous. They may pose a significant risk to health and safety, if not managed correctly. Let's go through our safety guide and recommendations. Always ensure the right chemical is being used for the right purpose. Never mix chemicals or decant chemicals into an unlabeled bottle. Always check the expiry date and read the label thoroughly. If the label is damaged, please contact us for a replacement. Read the technical bulletin and safety data sheet for further information and safety instructions. Make sure the correct dilution rate is applied to the product. Finally, make sure you wear the appropriate personal protective equipment, also known as PPE, when necessary. Never underestimate the importance of reading the label. Please ensure the product name, code number and expiry date are all as expected. Look out for the signal word. For example, danger or warning. Find the manufacturer or supplier details and contact information. And ensure you read the directions, safety instructions and any potential hazard statements thoroughly and carefully. Let's visualize. Any label will have the following: the product name, potential signal word, hazard statement and related pictogram, directions for use, the product size and code number. Please refer to the first 3 digits to identify the product. The description of the product. Manufacturer or supplier details. PPE requirements. What equipment you should be wearing when using the product. And finally, the safety directions you should follow. What are safety data sheets, also known as an SDS? They are documents that provide information about the hazards of a product, and advice about safety precautions. They state the manufacturer's detailed information, chemical identification, ingredients and properties, first aid and emergency information, handling, storage and disposal information, potential health hazards. Always ensure that all employees are able to access the safety data sheets whenever required. A master copy should be available in the supervisor's office. In case of any health hazard, provide a copy of the relevant SDS to the doctor. You can access all product safety data sheets online at cleanplus.com.au. Let's visualize. Section 1 will state the product name and code, the product's recommended use, emergency contact details and date of last update. Ensure that the SDS is current, and no older than 5 years. Section 2 states the potential hazards of the product. It shows you the relevant pictogram warning, which allows you to identify if there is a risk, and any hazard statements regarding the use of this product. Section 3 outlines the product ingredients. It identifies the hazardous product components. Section 4 is the first aid measures. Familiarize yourself with these instructions. Section 5 is the fire-fighting measures relating to the product. Section 6 outlines what to do in the event of a chemical spill. Section 7 is the handling and storage instructions. Section 8 is the personal protective equipment guideline for handling this product. Section 9 is the physical and chemical properties. This will tell you how this product is supposed to look and smell like. Section 13 outlines how you dispose of this product. Section 14 is whether this product is deemed a dangerous good when in transport. What is a technical bulletin? It is a document that summarizes the product with a description, directions, environmental aspects, product image and code. Always refer to the technical bulletin, SDS and label. Ensure the product matches the product image. Follow the directions for use carefully. Ensure all employees are able to access the technical bulletin when required. A master copy should be available in the supervisor's office. You can access all technical bulletins online at cleanplus.com.au. What is a wall chart? It summarizes the products that are on site or are color-coded accordingly. The wall chart should be placed throughout the facility, where the chemicals are stored and handled. The product name and code, application, usage, hazards and pictograms are all illustrated on the wall chart. Ask about our SDS and technical bulletin folder. An easily identifiable, fluorescent orange folder that can be placed throughout your facility. We also have a range of 20 screen-printed color-coded bottles. They allow for easy identification of the product, with the relevant instructions on the bottle. It is made to be reused as many times as possible, and is GHS compliant, improving the safety and effectiveness of the product. Understanding GHS symbols. GHS stands for Globally Harmonized System, which is a global method of classifying chemicals. Look out for the following symbols and understand what they mean. Corrosive chemicals are those that may damage another substance with which it comes in contact with. For example, machine dishwash liquid or oven cleaner. Flammable chemicals are those that may catch fire easily and may explode. For example, methylated spirits. Irritant chemicals lead to allergies and painful reactions. May cause physical discomfort. For example, chemical fumes and strong odors. Oxidizing chemicals are those that may react with combustible substances. For example, hydrogen peroxide. Respiratory hazards may cause aspiration issues. Wear appropriate PPE around your nose and mouth when using these products. Environmental hazards pose a risk to the environment. Please dispose of the chemical correctly. Understanding personal protection equipment. Handling hazardous chemicals may require the use of chemical-resistant gloves, safety glasses or face shields, aprons or adequate overalls when using solutions. Please refer to the safety data sheet, label and technical bulletin before using any products. Understanding where and how to store the chemicals. Store chemicals in specific and designated places. Store chemicals according to their hazard class. Check for any leakages from drums or storage areas. Perform regular cleaning of storage areas. Ensure proper signage and safety material, for example, the SDS and technical bulletin folder and wall charts are in sight. General First Aid Guide. When seeking medical advice, show your doctor the product label and the SDS. If treating an injured worker, always remember to protect yourself first. Contact the Poisons Information Center on 131126 if you need medical attention. If the potentially hazardous chemical comes in contact with your skin, rinse thoroughly with running water for at least 15 minutes, while removing contaminated clothing and shoes. Seek medical attention if symptoms occur. Eyes. Rinse thoroughly under running water for at least 15 minutes. Hold eyelids open, remove contact lens if possible, while irrigating the eyes. Seek medical attention if symptoms occur. Lung and throat. Remove to fresh air. If not breathing, give artificial respiration. If breathing is difficult, give oxygen. Seek medical attention if symptoms occur. Mouth. Contact a doctor or Poisons Information Center on 131126. Do not induce vomiting. Give a glass of water to conscious patients only. In summary, always Wear appropriate PPE. Know what you are handling. Read the label and SDS. Dilute the product in water according to the dilution rate. Know what to do in case of an emergency. Check for proper signage. Store, dispense, and dispose of chemicals in a safe and correct manner. Wash your hands after handling chemicals. Never use expired chemicals. Store unlabeled containers. Use chemicals from unlabeled containers. Mix chemicals. Inhale or ingest chemicals. Allow contact with skin and eyes. Eat or smoke near chemicals. Thank you for listening. Please complete the Knowledge and Understanding quiz in the description below.